Good morning. It's February 7th, and this is your daily brief in science. Here's everything you need to know. A new study has unveiled a monumental asteroid impact that took place approximately 3.8 billion years ago, resulting in the formation of two large canyons on the far side of the Moon. This asteroid, measuring around 15 miles wide, unleashed energy equivalent to over 130 times the total yield of the world's nuclear arsenals. Remarkably, the debris from this impact traveled at almost a mile per second and carved out the canyons in just about 10 minutes, contrasting sharply with the millions of years it took for the Grand Canyon to form. As NASA's Artemis program gears up to return astronauts to the Moon within this decade, plans are underway for a lunar flyby in 2026, followed by a potential crewed landing. The targeted landing site is at the Moon's south pole, an area that remains untouched by the asteroid impact and is rich in older, pristine rock formations. Most of the debris from the impact was ejected away from this region, indicating that NASA's exploration zone will be clear of such materials, allowing scientists to collect ancient rocks over 4 billion years old. These older rocks are crucial for understanding the early history of both the Moon and Earth. Researchers from the US and Britain utilized data from NASA's Lunar Reconnaissance Orbiter to analyze the impact site and confirm its age. However, there is still uncertainty regarding whether the newly identified canyons lie in permanently shadowed areas, which may contain ice potentially useful for future lunar missions. These shadowed regions are believed to harbor ice that could be essential for rocket fuel and drinking water. David Kring, the lead author from the Lunar and Planetary Institute, characterized the impact event as a very violent geologic process, underscoring the immense energy released during the collision. The asteroid struck the Moon after passing over the South Pole, creating a vast basin that significantly altered the lunar landscape. Atsena Therapeutics is making strides in the field of gene therapy, focusing on innovative solutions to prevent or reverse blindness caused by inherited retinal diseases. The company's lead program, ATSN-201, has shown promise in its development, aiming to address X-linked retinoschisis, a genetic disorder affecting primarily males. In addition to ATSN-201, Atsena is advancing another therapy, ATSN-101, which specifically targets Leber congenital amaurosis type 1. This therapy has demonstrated positive results in earlier trials and is now preparing for a global pivotal trial, marking a significant step forward in treatment options for patients. On February 13, 2025, Atsena will present interim safety and efficacy data from the ATSN-201 dose escalation study for XLRS, led by Dr. Christine Nichols-Kay. This genetic disorder, caused by mutations in the RS1 gene, leads to progressive vision loss and currently has no approved treatments, with around 30,000 cases reported in the US and EU. The ATSN-201 therapy utilizes AAV.SPR technology, which allows for lateral spreading beyond the injection site. This enhances transgene expression in the central retina without requiring surgical detachment, thus minimizing risks associated with the procedure. Currently, the ongoing Lighthouse study is a Phase 1-2 clinical trial assessing the safety and tolerability of ATSN-201 in male patients aged 6 and older diagnosed with XLRS due to RS1 mutations. Enrollment for this study is ongoing, and the therapy has been granted orphan drug and rare pediatric disease designations by the US FDA. Atsena Therapeutics is positioning ATSN-201 as a best-in-class gene therapy candidate, leveraging novel AAV technology to achieve effective gene expression in retinal photoreceptors. The safety and efficacy data for ATSN-201 will also be presented at the Macula Society's 48th annual meeting, scheduled for February 12, 2025, in Charlotte Harbor, Florida. With a foundation built by leaders in ocular gene therapy, Atsena Therapeutics is committed to addressing the needs of patients suffering from vision loss, aiming to provide innovative treatments for inherited retinal diseases. A recent study reveals alarming effects of air pollution on cognitive functions, suggesting that even short-term exposure can hinder our everyday tasks. Published on February 6, 2025 in Nature Communications, the research was conducted by scientists from the universities of Birmingham and Manchester. The study tested 26 clinically healthy adults, exposing them to high levels of particulate matter from candle smoke and comparing their performance to those inhaling clean air. The results showed that brief exposure to this air pollution significantly impaired critical cognitive functions, including selective attention and emotion recognition. Participants exposed to particulate matter struggled to recognize emotions in faces, which could negatively influence their social interactions. Dr. Thomas Faherty highlighted that these individuals found it challenging to ignore distractions, potentially leading to impulsive behaviors, such as increased impulse buying while shopping. While working memory appeared resilient to short-term pollution exposure, other cognitive functions proved more vulnerable. Professor Francis Pope pointed out the broader implications of poor air quality, indicating that it could adversely affect intellectual development and worker productivity, ultimately impacting economic growth. The study underscores the urgent need for stricter air quality regulations, particularly in polluted urban areas, to safeguard brain health. This research is part of a larger initiative examining various pollution sources, aiming to inform future public health policies. Faherty noted the importance of identifying specific pollutants, such as those from cooking or cleaning products, to guide targeted policy changes. With the World Health Organization estimating that air pollution causes approximately 4.2 million premature deaths annually, the need for action is critical. Recent research led by Max Fineland has unveiled a fascinating connection between lightning and space weather. The study reveals that electromagnetic waves generated by lightning can trigger electron showers from the Van Allen belts towards Earth. These electromagnetic waves create Whistler waves that travel into space, interacting with electrons in the inner radiation belt. This behavior is similar to that of chorus waves, which are known for their distinctive chirping sound. The inner radiation belt, located approximately 621 miles from Earth, contains stable high-energy protons and electrons, while the outer belt exhibits more dynamic behavior due to solar activity. The findings highlight the complex relationship between Earth's atmosphere and space phenomena. The study identified a correlation between bursts of electrons and lightning activity, particularly following geomagnetic storms caused by solar eruptions. This suggests that terrestrial and space weather are intricately linked. Moreover, disturbances in the Van Allen belts can occasionally displace particles, leading to electron rain in Earth's atmosphere. With trillions of charged particles, primarily protons and electrons, typically held at bay by Earth's magnetic field, the research underscores the nonlinear nature of scientific discovery. The Van Allen belts, discovered during the Explorer 1 satellite mission in 1958, reveal intense local radiation and have significant implications for understanding risks to spacecraft and human activity in space. Notably, while chorus waves were thought to primarily affect the outer belt, recent studies challenge this by indicating high-energy electrons are also present in the inner belt. This evolving understanding contributes to a deeper awareness of the intricate dynamics of our planet's interaction with space. A new comprehensive study has revealed significant insights into colorectal cancer screening, analyzing data from 13 diverse research projects conducted between 2011 and 2023. This extensive research involved over 4.4 million individuals from countries including Spain, France, and Taiwan. The findings indicate a clear dose-response relationship, showing that individuals with higher fecal hemoglobin concentrations faced significantly increased risks of colorectal neoplasia. Specifically, those with concentrations of 5, 10, 20, and 40 micrograms per gram had risks escalating up to 13-fold compared to individuals with no detectable fecal hemoglobin levels. Gastroenterologist Theodore R. Levin highlighted the potential benefits of risk-stratified screening strategies in the United States. However, he noted that currently available fecal immunochemical tests do not report fecal hemoglobin concentrations. The feasibility of implementing such risk stratification is supported by data from national screening programs across Europe and Asia. Led by Danica M.N. Vandenberg from Erasmus MC, the research team advocates for screening strategies that incorporate fecal hemoglobin concentrations to enhance early detection of colorectal cancer. This aligns with previous studies that consistently link fecal hemoglobin levels to neoplasia detection. emphasizing the importance of risk assessment in screening protocols. Importantly, higher fecal hemoglobin concentrations from prior negative screenings were predictive of advanced neoplasia, suggesting a need to refine current screening protocols. The systematic review also highlighted variability in stool positivity cutoffs across studies, ranging from 10 to 80 micrograms fecal hemoglobin per gram, which could impact screening effectiveness. Vandenberg acknowledged the importance of ensuring that reducing screening frequency for low-risk individuals does not negatively affect overall population health outcomes. Ongoing trials are being conducted to explore the acceptability of tailored screening intervals based on fecal hemoglobin levels. The study was funded by the Dutch Organization for Scientific Research, with authors disclosing no competing interests. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. We'll be back Monday with everything you need to know.